doctors follow the Rotterdam Criteria to diagnose PCOS. This defines PCOS as the presence of any two out of the following three criteria. The first criteria is oligo-ovulation and/or anovulation. This means ovulation is happening irregularly or not at all. This is evidenced clinically by a progressive delay of periods or a reduction in the flow. For example, if you earlier, let's say, had a 28 to 30 day cycle, then the period started getting delayed by 5 or 10 days, then 15 to 20 days, and then months would get skipped. This means you might have oligo-ovulation or anovulation. Another possible change is that, say, earlier you used to bleed for 4 to 5 days in the month, and now the flow has progressively reduced to 1 or 2 days, or in some cases, just spotting occurs. This also means you might have oligo-ovulation or anovulation. There are other ways of assessing ovulation. The most common one used by us doctors is ultrasound, where we do a TVS or a transvaginal scan for follicle monitoring. The second criteria is excess androgen activity. Androgens are masculine hormones, which are normally present in very small quantities in young women. Due to the complex interplay of lifestyle and hormonal imbalance, the amount of androgens in the body rises in PCOS. The clinical symptoms of this are acne, that is pimples. You may notice mild to severe degree of pimples on the face, upper back, shoulders, upper arms. These may be recurrent, that is happening repeatedly, or they may be resistant, that is responding poorly to treatment. Another clinical symptom of excess androgen activity is hirsutism. That is excess hair growth over the face, especially the V area, the side buns, the jawline, the chin, over the neck, breasts, abdomen, upper back, thighs, arms. You can take pictures of the areas you feel have an extra hair and over time track how the hair growth is improving or deteriorating. Serial photographs of the hairy areas also help your doctor track progress and assess the effects of the treatments. Other ways of assessing androgen excess are doing a hormonal profile on a blood test. The third criteria for PCOS is an ultrasound picture. If polycystic ovaries are seen on ultrasound, the third criteria is met. In a nutshell, if you have one or more of the following, you must consult a doctor. If you are overweight, if your periods are delayed by over 35 days and you're not pregnant, if the flow in your periods has reduced to less than or equal to 1 day, if you have acne, if you have excess hair growth on the usually non-hairy areas of the body, like face, chin, breasts, abdomen, back, thighs, arms, if you notice dark pigmentation on your neck, if you're trying to conceive and haven't been successful over a few months. After a clinical evaluation, your doctor will advise a hormonal blood test and an ultrasound. These tests are best done on the second or third day of the periods. Irrespective of the amount of flow, the day the flow begins is day 1. The next day is day 2, and the day after that is day 3, and so on. For example, if your period began on 10th January, doesn't matter whether day or night, then you can get the tests done on 11th or 12th of January in the morning. If PCOS is diagnosed in you, the treatment is individualized, depending on what your main concerns are. That is, whether you want to conceive, or is acne the main issue, or are your blood sugar levels elevated, or is it your hormonal levels? However, one aspect of treatment of PCOS is common to all, and that is something that is right under your control. That one aspect is lifestyle improvement. A healthy diet, regular exercise, good sleep, and low stress is a recipe for a healthy lifestyle in many ways, but more so for PCOS.